It's time to enhance the relationship between expertise and impact, between knowledge and application. Welcome to a journey of discovery and empowerment. Welcome to All Physicians Lead, the Forbes Books podcast that highlights the critical leadership role that all practicing physicians take on every day. Here's Dr. Leon Morse.
I'm back with Dr. Doreen Addrizzo-Harris, professor of medicine at the NYU Grossman School of Medicine. We've been exploring her journey from, yes, an aspiring jazz dancer to leader in pulmonary and critical care medicine. You have 23 years as program director. Tell us some of the key leadership lessons you've learned, particularly how do you help young physicians recognize their impact on healthcare teams and patients? How do you mentor them to grow into leaders? We're interested in how you develop their skills and leadership styles to achieve their goals. What does that look like?
Yeah. So we're very lucky in my particular area. Anybody who wants to go into pulmonary critical care or critical care are usually already unbelievably hardworking physicians. So we're very lucky, and they're not afraid of working hard, and they're not afraid of taking care of the sickest patients and often being in the most difficult scenarios with families. So I think that I'm very blessed in that those that I do get to train are very dedicated. I like to set the example. I have very high expectations. The bar is very high, very high. You don't have to hit it, but you have to be reaching for it. And they know that. I expect them to be an extension of me, and anything that they do, they know I had better be happy about it. And I'm not just talking about they're learning how to care for these patients, but it's their teamwork, it's their professionalism, it's their communication skills, it's their empathy, it's their dedication. Those are the skills that are key. Anybody can learn something that's in a textbook, and over time learn how to apply it to the patient. Those other skills, sometimes if you're not good at them, and maybe your parents haven't taught you them sometimes, I don't know.
Right. Everything I need to know I learned in kindergarten, right?
But I do think I model it, and they know they know that I'm unbelievably understanding. My door's always open. I'm very transparent. They get open and honest feedback from the beginning. And my goal is that in the 3 years they're here with us, we will be polishing them and shaping them into the best doctors they can be. But they're going to get a lot of feedback, and they're not always going to do everything right. And they know that they can come to me and they'll get honest feedback. It may not always be good feedback, but they'll get constructive criticisms on ways to make it better. And so we do a lot of one-on-one mentoring, if needed, weekly, monthly. Sometimes we even put them through these immersion, one day, a different attending every day, one-on-one immersions for 1 to 2 weeks, just so they feel they're in a safe environment, a safe place, can ask any question they want. They won't be judged or graded. And so, I have a lot of different ways to mentor, because why? Every physician learns differently. And so we have a lot of different choices to pick. But the key is having an open door policy, being here, setting the expectations, and then just working through them as they grow. And I think most of us are at very great places, because physicians like to teach and are, for the most part, very dedicated. So they don't only have me. They have another, 100 faculty that they're going to be coming into. A large amount of them are involved in medical education. So a lot of people that are going to really love teaching them. And I think that's the way it is in most of the training programs. There are many, many physicians out there who just are so dedicated to teaching these young doctors. So yeah, but the honesty is very important. I love honest feedback.
Yeah, it's good. That's how you grow, right? That's what we talked about a coach. I mean, Michael Phelps coaches and saying, "Oh, that's all great. You're
That's
perfect.
right.
Nothing to improve upon." What that doesn't help you. You fire that coach. You know what I mean?
That's right.
It's
That's
funny you said everybody learns differently, and it sort of clicked in my head when you said any textbook, and you say that to learners these days, and they're like, "What's a textbook? I- what are you talking about? Nobody has books anymore. What is it? What is that thing?" Um, the comment you made earlier, I wanted to pull a little bit on that thread about reflection. You were talking about how you use self-reflection to improve constantly. Are there any particular tools, or can you give us some examples for folks who may not do that of how valuable you find it, the frequency that you might employ something like that? Is it PRN? Do you have a regular pathway that you follow? How does that play out in your leadership growth?
For me, it's fairly individualized. I'm a runner, and I find that I run without music, without anything else around me. I mean, I just run either outside or on a treadmill, and that is my time to reflect. I any problem I have as well, some things that are very challenging at work, I don't know what to do. If I run for 30, 60 minutes, the problem is usually solved by the time I'm done with my run. I have the answer. The longer you run, the harder problems get solved. I do believe those endorphins happen. It's quite magical for me anyway. So that's a great way. That is a very good stress reducer, and also helps me think about a lot of the different things that may have been in my subconscious and not bothering me. They kind of come out when I'm running. But one thing that I do is I have these little calendars in each of my offices that are like a special saying of the day. They make many different ones. I have a few behind me. So one says, "Some days you have to make your own sunshine."
Oh,
And I'll reflect on it. I'll send it to a group of, maybe I'll send that one to the fellows. Maybe I'll send it on to a family chat, to just think about, okay, we're here for work, but let's just think about the rest of the world. Or let's just think about how you're going to get through the day when it's maybe not a good day.
yeah.
Um,
That's
I
a good one. I like that.
I have another one that says life is tough, but so are you. So not
Oh,
to forget. So I really do use those to kind of just make you remember why you're here, why you're doing these things. And there are going to be a lot of challenges, but so what? That's okay. If we didn't have everybody could do it if there weren't challenges, right?
that's
So
right.
if there are a few challenges, you get through them, it gives you the experience then to teach others how to get through those. So I'm always a glass half full positive person. Might be upset and screaming at things that are happening, but I'm always positive we're going to get through it. And I think that's really very important. Trying to find that silver lining when sometimes it's really gray out. I think if you can do that in the most difficult situations, it will give you the energy for that next day or for that next tough, difficult senorio.
Yeah, yeah. We used to say if it was easy, there'd be a booth at Sears, but now nobody knows what Sears is either. So, well, I got to change the old guy saying here, the old geezer saying. Let's talk a little bit about the American College of Chest Physicians, something we're both quite familiar with. You have had a long and very distinguished journey with that organization. To the folks who are thinking about getting involved in their national societies of various types, how did that path work for you? What were some of the exciting accomplishments, some of the challenges maybe of fitting in that commitment with your family and your work at the hospital and continued educational journey? We all try to find that work-life balance things. How do you carve out a big chunk of time for the ACCP, and how did all that play out over the last many years? I won't do the math.
Yeah. So I would say it's extremely important to get involved in regional, national associations. I try and get all of my fellows involved in something in one of the national associations early on. That networking, as you know, Leon, is so important for whatever your career is, whether it's in medical education, whether it's in a niche of pulmonary, whether it's in the surgical area. The networking, learning from others, how others do it, having those people be your supporters as your career grows is extremely important. And I think it's probably been the most satisfying part of my life, getting to know physicians from all over the country. And especially having been trained primarily at one institution my whole life, it's great to be able to visit and see how others do it in other institutions in other parts of the country. I think CHEST has been, an unbelievable organization. Again, the best in medical education, I think that you're going to find. Innovative, which is phenomenal. And the other great thing about it is how encouraging and openness to anybody there. You can easily find your way. There's a friendliness from all the leadership to the most junior faculty and trainees. So a lot of that socializing and networking is probably one of the most important things about being part of CHEST. We've grown so many programs, yes, in disease specific areas, but now I mentioned the First 5 Minutes, which is a communication program. We're building programs that are like linking primary care doctors into the pulmonary world for early diagnosis, and all of these other great projects that they're doing have been really phenomenal. And for me, I think it was a true honor to be president. I'll be off the board. My last year ends December. I really think that I moved my leadership level up a step because this was something new. Being able to be a person that phenomenally expert physicians from all over the country would listen to and follow my lead. That was pretty amazing. And, how do you do that so that that happens? And I think, again, one very important thing was listening. You need to learn how to listen to everybody, and how to balance the views and, lead the discussions. Again, being president, you want to decipher it a little bit and then maybe pick one or two or three of the most key points. That's your job as the president. But learning to listen and making everybody feel like they were heard. I was president during a very tumultuous political time in our country, a lot of different opinions, a lot of different changes with the Supreme Court and the laws that, affected many, many individuals, a lot of diversity issues coming up. So really listening, letting people know they're heard, and then coming up with actions that are going to be very inclusive, really, I think was the key. And I think CHEST is one of the best places for everybody to feel like they can join and be accepted. And I think it was just a fascinating time for me. I can't answer that other question you asked. How did I balance it with work and school?
It's a question every listener wants to know. Oh my gosh, how did she do all
I
this?
just keep telling my
Yeah.
husband, "Wait, honey, it's only like 35 more days,
Ah,
and then you will have me back."
uh,
Um,
maybe.
so
More motorcycle trips. Yeah, yeah, yeah.
you do have to get buy-in, family, and then I will be on more motorcycle trips. I've had to curtail them. But I do think you have to have a supportive environment around you. You have to have a supportive family, supportive work environment, that's something, but it benefits everyone. I mean, it benefits all of those who work here with me at NYU Bellevue, because, I can be their resource for how to get involved and who to connect them with in their specialty of interest. So that has been phenomenal. And I think my family, whether they like it or not, they've come to every CHEST annual meeting for the last 4 years. So they've had fun. But they haven't seen me as much as they would like to. But That's okay. I think they're getting used to it now, so now I don't think they're gonna want me back till
Not gonna say, "Wait, aren't you gonna do something else?" We're
that's right. They're like,
But
"What?
that
You're home now?" Yeah.
that old joke when when the guy retires and he's kinda hanging around the house all the time, and the wife says, "Our vows were for better or for worse, but not for lunch, so you need to find something to do,"
Uh,
right?
yeah,
So,
yeah.
um,
So, yeah.
so a little bit about that trajectory through chest. Obviously, you start out as a junior practicing physician, I assume, and probably volunteer for some committees and sort of walked along that pathway. Was that intentional? Was it organic growth? Was it random? How did that work? And again, for folks who are just starting out in those, how do you chart that pathway to leadership like you experienced?
So I do think now I encourage my fellows, don't just apply to one committee or whatever. Find a few that maybe you don't think are as popular. Apply to those as well, because it doesn't matter that you're on the most popular. Get on a committee. Once you're there and they see how good you are, you will get asked to do many other things within the organization. So I tell those young doctors, find someone else that you know that's involved in chest and have them chaperone you and bring you around at the next annual meeting. Apply for our leadership. We have many travel grants. We have many different mixers where we have leadership meeting with people who are interested in different diseases. Go to the network mixers. Pick if you like pulmonary hypertension, go to that network mixer. It's all about who you meet, who's going to be your mentor, and who shepherds you through. I got lucky enough because I was lucky to know Dr. Mark Rosen, and he was right down the block. He knew me. He got me involved in chest early. I gave a talk, a TV talk back in the day. That's how what I started in, and somebody asked me, "Oh, would you like to be on our steering committee?" So, you have to be there, you have to be visible, but the best way to get there is to do it through someone who's already there, or, go on. There are many, many, many committees to apply for. And don't be upset if you don't get on the first time around. Try again. It might take 3 or 4 tries till you get on, but you will get on. And again, it's just networking, talking. It's a very welcoming association. Lots of different venues. The annual meeting is fun. Great way to meet a lot of other people in your area of interest. So yeah, for me, it was relatively easy. Uh, Once I said yes to be on one committee, then there are a lot of requests to do this, to do that, and again, in the beginning, say yes to everything. And then as you get to see what you like and what you're good at, then you can start to say no. And then when you get to be my age, you got to say no
A
more.
lot more because everyone's asking you for another piece, right? Yeah, no doubt, no
Yeah.
doubt. One of in that vein, one of the things that I encourage folks to do is to do well. First, be there, say yes, get involved, but then do well because they call it committee work because there's work. There's work to be done. So be that person who is ahead of the deadline. Be that person that the committee chair doesn't have to keep emailing saying, "Hey, have you finished your part of the project yet?" Be the person that does, the 3-page summary instead of the 7-page summary so that it's concise. What is that committee looking for? What are they
That's
and and really do good work because you're a good person, you care. It's that extra little piece that says, "Boy, when I ask, you know, Joe or Joan or Susan for something, they're on it, and they're dependable." Really important.
the first experience you have is so important because you can't change your reputation and they don't know you. So, as you said, they want somebody who's going to answer those emails right away, somebody who's going to volunteer to do the project and do it well, have it there before the deadline, who's going to be wonderful to the staff, lovely, nice to the
Yeah.
staff and
Be
professional to the
nice to
staff.
everybody. Yeah.
Absolutely. And guess what? If you build a reputation like that out the door, on day one, you are set. You're golden for the rest of your career. And I don't think people realize that. So that's unbelievably good advice, Liana. It would be very, very important. So give it 115% that first go around. I mean, you should do that every time you do it, but that first impression is going to stay, particularly with the staff. A lot of these organizations, it's the staff who put in a good word and say, wow, that doctor was so easy to work with, so great to work
Yeah.
with, right?
Yeah.
So,
Because from our lens, when you've been committee chairs and you've been in leadership positions, those 3 or 4 people that you just have to keep bugging uses up a lot of your time and mental energy and emotion to get that done. And boy, you just really love those folks that you don't have to poke at to do what they said they do, bottom line.
yeah.
So incredibly stressful work, and certainly you touched upon it over the past few years with the pandemic. Certainly, you're right in the thick of that, not just geographically, but also in terms of your specialty. What advice do you have? I mean, hopefully we never see anything like that again. We hadn't seen anything like that for, over 100 years. But people are involved in, highly stressful environments day to day. Any tools, advice that you have for folks to be prepared for things like that? Any lessons learned from the pandemic at all around those times that, from your standpoint, you would share with learners, with other physicians?
Well, I think it tells you to value the rest of your life and make sure you're doing something that you like to be doing and make sure that you are spending time with your family. You never know when the world's going to change. And so for many of us, I think the things that I hadn't done that I've been saying I'm going to do forever, right? I'm like, okay, it's time. Better start doing it now because who knows, right? I take my Italian lessons now at 5 a.m. several times a week. And I've always said I was going to take my Italian lessons for the last 20 years. So I've been doing that since 2021. But I do think it makes you relook at everything you're doing, the teams you work on, being better prepared. I was in charge of staffing all of the ICUs at NYU and our 4 hospitals. And we had a new ICU starting every day. We couldn't find the doctors. It was pretty much a 24/7 job. I don't remember some of it. Um, so, about being prepared for the future, I, have those. We've been through a few things between Hurricane Sandy and all our hospitals closing for
Oh yeah.
several months and having to evacuate all our patients. And, I have everybody's personal emails, all emergency contacts are all separate on paper in
Yes.
a
Yeah.
file
Yeah.
at home. I mean, because we've had to use that certainly. I just think, having your command central, we know we have our little command central of who that is when we have these problems happen. We have a NETEC disaster unit here at Bellevue, staffed by some of my senior critical care doctors. So they're always getting called. Monkeypox was coming, right? They're always getting called to be ready, several times a year for whatever might be coming down the road. So we had our Ebola patient back in 2014. I think that was, yes. So, we're used to these kinds of disasters and many of our faculty are ready to be called at at the last second for whatever it might be. For me, I think, yes, I don't want to be in these situations again. I mean, I don't want anybody to have to go through, but what an unbelievable time to be a physician.
Very
And how
true.
much
Yeah.
we could learn and how much we had to learn on spur of the moment. We were doing 2 journal clubs a week to try and keep up with looking at autopsy specimens and, everything was, learning because there was nothing out there to read about this. So, yeah, I think it's kind of it's very similar to, I think, being in the armed services. You're there as a physician ready to be called when you are needed. beyond what we might do for our regular jobs. And that's just our calling. Um, and we need to do it. And so, I think hopefully we won't be in another situation like this. I think we learn to be a little bit more ready for it in resourcing. I mean, just to think, I mean, even with the IV shortage lately, that, with the one plant in North Carolina that, right. I mean, we're just not in that disaster planning mode, right? I mean, we seriously stockpiles there should have been of such a simple thing, right? And there are hospitals having to delay surgeries. Unbelievable, right? That we haven't thought about it. So, trying to think through many of those things in advance for us, just having our staff know, who the central control is going to be, and then thinking about your lives and trying to make sure that you enjoy each day. I mean, this might not be a good thing to end on, but enjoy
Oh, we have
living
one more question.
day as if it were to be your last. Is kind of the way I live my life. So I do think try and get the most out of every day, and try and try, as we said, bring a little bit of sunshine, whether it's into your own life or to someone else's when there isn't much sunshine going on. If we could do that every day, we would be in a much better place.
Yeah. Yeah, it's the courage of all of our teammates, physicians, nurses, technicians, administrators who were in the hospital during those days when we really didn't know how deadly this might be, but coming in, putting on the suits, donning the gloves and the masks, and taking care of patients every day was truly heroic. No question about it. And even a level up from the military, when you join the military, you know that you might put yourself in harm's way. And I don't want to minimize the impact that a soldier being injured or worse has on their family back home. But in this environment, the folks who are coming in to take care of patients in the hospitals were potentially making their family sick as well. And that just struck me as being so courageous and so deserving of respect that they and many others, first responders, our heroic, delivery teams that, kept people with food and supplies for a long, long, long time. So yeah, we've been through a lot together, and, sometimes reflecting on even that, hopefully will pull some of us together in
Yes,
times like
it
this. So,
does. Yep.
um, so, sort of a wrap up overall global thought, recommendations, pearls that you have for physicians in general, physicians who are leading every day, influencing patients and families and team members to take great care of patients. What are your parting words of wisdom from all of your years?
As I said, try and enjoy what you're doing. Take time out to think about what you're doing and where you want to go. Get yourself that mentor. Even when you're a leader, you need to have that mentor. You need to have that person you can bounce things off of, internal, external. I like to have a few, have that phone a friend line. It's really important to handling situations or just handling some of the stress that you might be going under. Don't forget about your team, and don't forget about your patients being people. Remember that people are really looking up to you. So your example, it has to be without a blemish, because people are really copying everything that you do. And I don't think we realize that so much. I feel it more because I have so many fellows always copying everything I do. But when you're like really up, a division chief, whatever, I mean, your people are looking up at you. They are, you are, to those junior attendings, they look at you and you're godlike, really. And you have to realize that it's really important. So showing them that you're human and that you have that human side too is important. But I do think expectations that you set as a leader and how you live those out is really, really important for the other physicians that are coming up the ranks. We really have to set the example for them. And I wish and I hope that everyone who's a physician can get joy out of the work that they do every day, because it is so important and it is such a calling. And I do think such a blessed calling.
Can't say it any better than that. Professor Dr. Addrizzo-Harris, Doreen, thanks for taking the time to share all of that wisdom. Thanks for taking care of patients, families, colleagues, the way you've always done. I know my family has benefited from your leadership and mentorship tremendously. So from a personal standpoint, I can say that with great respect and appreciation. So appreciate you taking the time today.
Well, thank you, Leon. I'm very honored that you asked me to be on your show. So thank you so much.
You are very welcome. It's been awesome. Thank you for your time and, of course, your most valuable insights. That's it for another episode of All Physicians Lead. If you like the show, please subscribe so we can notify you about new episodes. In addition, of course, please take a moment to leave us a review so others can benefit from the leadership insights of our terrific guests. See you next time as we continue redefining physician leadership.
This has been All Physicians Lead. We can all be better leaders, and our teammates and patients will be the beneficiaries. Go to allphysicianslead.com to unlock your potential, sharpen your impact, and elevate your journey. All Physicians Lead with Dr. Leon Morse is a production of Forbes Books.